Good afternoon and welcome to the GRICS Annual Forum for 2022. I'd like to commence this by acknowledging the traditional owners of the land on which I meet you from today, which is the Briarkalung clan of the Gunai-Kurnai Nation, and I pay my respects to their elders past, present and emerging. I extend that to any Aboriginal and Torres Strait Islanders that may be joining us today, and also acknowledge the various lands from which you are all meeting today, and pay my respects to their elders past, present and emerging. I'd like to commence today by discussing or talking about a number of projects that GRICS has undertaken over the past 12 months. And really the first thing we did to kick off the year was to undertake a cancer services plan for Gippsland. The project was initiated by the Department of Health, and they funded all the regional cancer centres across Victoria to undertake a cancer services, to develop a cancer service plan. GRICS has supported this initiative through providing a large amount of data to inform that plan, as well as being actively involved in the engagement process with our health service partners, to understand what their needs are in terms of cancer and how we can deliver better services for Gippsland cancer patients. So I'd like to thank the Department of Health for undertaking this initiative and likewise for the funding. Over the past 12 months, GRICS has been working closely with a number of our other integrated cancer services across Victoria to implement projects under the Victorian Integrated Cancer Services implementation plan. That implementation plan is heavily informed by the Victorian Cancer Plan. The implementation plan has 18 focus areas where each integrated cancer service undertakes a project or a series of projects to deliver statewide improvements that are related to that Victorian Cancer Plan. GRICS has been working closely with our partners at Southern Metropolitan Integrated Cancer Service on a repatriation project for central nervous system cancer, or brain cancer more specifically. What we've been looking at doing is improving the referral and repatriation pathways for those particular patients between Metropolitan Services and Gippsland. Unfortunately, we've become aware that the communication between Metropolitan Health Services and regional health services is not always sufficient, such that when the patient is repatriated back to a regional service, that we have enough understanding about what their journey was during their time at the Metropolitan Health Service. So the project has really focused on understanding what our clinicians need in Gippsland in terms of understanding the patient journey, and likewise how we can better link them in with MDMs and other services that would increase our clinicians' understanding of that particular patient's journey. We've also spoken to a number of consumers across Gippsland to understand how they want health services to do repatriation better. And a lot of this has come down to communication. So we've been lucky enough to have a number of meetings now with the Department of Health and understand their digital health roadmap and how that might be used to inform repatriation, not only for Gippsland patients but also for other regional patients across Victoria. GRICS has also been working closely with the Barwon Southwest Regional Integrated Cancer Service on projects that will deliver care closer to home, or chemotherapy in the home. We're undertaking an audit across the state at the moment to understand what projects are happening across Victoria in this particular space, and likewise working with Barwon on their projects which are looking at the feasibility specifically of care in the home and how this can be done in the regional setting. So again, that will inform projects into 2023. and we look forward to delivering on this particular initiative. We're working closely with the team at Grampians Integrated Cancer Service to look at how we can better understand supportive care, how we can learn from our patients or understand from our cancer patients what their particular needs are. And we've been lucky enough that Cancer Care Victoria have undertaken a project alongside this called the Access Project, which you'll hear more about today. But effectively what the Access Project does is looks at increasing the amount of services in the supportive care space for cancer patients. Locally, GRICS has been working on a number of projects to, again, obviously improve the patient journey for cancer patients across Gippsland. Two significant projects that I'd like to cover off first include the neuroendocrine tumour model of care, which GRICS developed in consultation with Peter MacCallum Cancer Centre and Neuroendocrine Tumour Australia. What this project entailed was working closely with Professor Michael from the Peter MacCallum Cancer Centre, as well as Simone Maiden, the CEO of Neuroendocrine Tumours Australia, to develop a model of care where patients with neuroendocrine tumours can receive a lot more treatment closer to home. So we've now established a neuroendocrine tumour clinic within the Gippsland Cancer Care Centre. So patients are seen on a monthly basis locally here, and then we have a partnership with Peter MacCallum Cancer Centre such that we can access their tumour specialists as required, and likewise they can actually come down to our neuroendocrine tumour clinic at least once every 12 months to meet with the patients and meet with the clinicians. This project has also delivered a upskilling opportunity for our Gippsland clinicians. Another significant project that we undertook over the last 12 months is the Aboriginal and Torres Strait Islander clinician education package. This particular project was established on the back of the rollout of the Aboriginal and Torres Strait Islander Optimal Care Pathway, or OCP. So GRICS actually undertook a clinician readiness survey back in 2019 to understand or get an understanding of how ready our clinicians were to roll out the Aboriginal and Torres Strait Islander OCP. After undertaking that survey, we knew that there was reservation from our clinicians in terms of what they knew of Aboriginal and Torres Strait Islander culture in relation to health service or healthcare delivery. So we worked closely with, again, the team at Southern Metropolitan Integrated Cancer Service and likewise Monash Health, and developed a whole clinician learning package. So we ran this training session for local clinicians and likewise our Aboriginal Health Liaison Officers. So basically the way the learning package was developed was accepting that there's a lack of understanding from our clinicians in terms of the needs of Aboriginal and Torres Strait Islander people and their specific health needs. But then likewise understanding that our Aboriginal Health Liaison Officers may not have an in-depth understanding of the cancer patient journey. So the learning package actually delivered on two parts. Other projects that we have undertaken over the past 12 months is the Ophelia project, which is a health literacy project. So we've undertaken this in partnership with Swinburne University. And basically what this project looks at is understanding the health literacy of a given population, and then once that is understood, developing a number of co-design projects with the community to improve their health literacy such that we can have people becoming advocates for their own health rather than just participating in a health journey. We have a significant scholarship fund that we make available to clinicians across Gippsland each year. So over the past 12 months we've made $25,000 available to scholarship recipients. Again, you'll hear from one of our scholarship recipients later on this afternoon as part of our annual forum. And likewise, service improvement grants. We made $350,000 available to our health service partners across Gippsland to undertake service improvement projects within their own health services aimed at improving the cancer patient journey. Finally, we've been working closely with our consumer groups to again ensure that consumers are involved every step of the way in terms of our projects and what we as an integrated cancer service are focusing on in terms of the projects that we're delivering and ensuring that we've got the consumer voice front and centre for those projects. In wrapping up from this, I'd just like to acknowledge the hard work of the GRICS team and likewise the integrated cancer services across Victoria. It's been, I think, a challenging 12 months with COVID and the like interrupting some of our work and likewise the challenge that has presented to get some of our projects front and centre in front of health service executives. So I cannot thank my team enough for the hard work that they've put in over the past 12 months and likewise to the other integrated cancer services. And I also extend that to the Department of Health for their ongoing funding of integrated cancer services and the important service improvement work that we do. Thank you. I'd like to introduce you to Danielle Roscoe, who's one of our nurse practitioners from the oncology department here at Latrobe Regional Hospital. Danielle is one of the GRICS scholarship recipients from this year. Danielle was able to attend the American Society of Clinical Oncology conference in Chicago this year as a result of a GRICS scholarship.
Hi, I'm Danielle Roscoe. I'm the oncology nurse practitioner at Latrobe Regional Hospital. This year I was lucky enough to attend the ASCO annual meeting, which is the American Society of Clinical Oncology. The meeting was held in Chicago in America. It was a 5-day conference and I was lucky enough to attend thanks to the GRICS scholarship program, who provided me with $3,000 to attend the event. This conference presents all the latest research in oncology and haematology cancer care across the world, mostly in America. So being able to attend this will help me to be up to date and provide the best quality care to our cancer patients here in Gippsland. The conference is mainly attended by haematology and medical oncology consultants, but other allied health and nursing professionals can attend. There's 40,000 people walking around trying to go to different things and learn about the new advances. So it was definitely the atmosphere and being amongst it and talking to colleagues from different countries as well. I think as soon as they heard any Australian accent, they were surprised that people had come across from Australia. So I think it was very lucky for me to be able to go there, especially coming from a regional area. So the standout for me was when the results of the Destiny breast trial were presented. There was really good outcomes and it was a standing ovation, so it was really nice to be a part of that, and I felt really inspired amongst my colleagues to be able to celebrate those outcomes. It was really inspiring to be there amongst all of your colleagues with all the hard work that we do to try and improve the care of our patients, to show that things are advancing and working. I think that being in that environment and actually being there face to face, you're able to remember things a lot better rather than on the catch-up videos, and being able to talk to your peers about how they do things in their setting, which I think is really valuable, especially being in a regional area, because we can bring that back here and improve our services. And it was exciting, actually, some of the other colleagues from Australia that were there were from regional centres as well, so we were all there over in America together at this international conference coming from regional areas where we can improve care for the patients out of the metro areas. Some patients are hesitant to be seen locally and would rather go to Melbourne, so in this way we can promote that we are staying up to date with the evidence by attending these international and national conferences to give them the reassurance they're receiving the best possible and up-to-date care. It was really clear from the conference that we're heading for a more targeted approach to therapy within cancer care. So this means we're looking more therapies that target cancer cells specifically rather than affecting other cells within the body. I think being an oncology nurse and then becoming an oncology nurse practitioner, I never saw myself attending an international conference, so it was really beneficial to me to be able to attend, and will definitely affect my practice.
I'd now like to introduce you to Meredith Cummins, who is the Chief Executive Officer of Neuroendocrine Tumour Australia. We worked with NET Australia as well as Peter MacCallum Cancer Centre on a model of care to deliver better care for NET patients in Gippsland by establishing a shared shared care model where those patients would receive care in Gippsland, but under the guidance of specialists from Peter MacCallum Cancer Centre, as well as oversight from Neuroendocrine Tumour Australia.
Thank you so much for asking me to present today. My name is Meredith Cummins and I'm the CEO of Neuroendocrine Cancer Australia. And it was a great privilege to be involved in the development of the shared care model between Gippsland and Peter MacCallum Cancer Institute. So I just thought I'd touch briefly on what neuroendocrine cancers are, and I know most of the audience will know anyway, but they are a complex group of tumours that are predominantly in the digestive and respiratory tract, but they can occur anywhere in the body. So we commonly say when we call them a NET, which is neuroendocrine tumour, that they're a nearly everywhere tumour, so they can occur anywhere in the body. As we know, neuroendocrine tumours can be very slow growing, and there's a lot of patients who have been living with it for 10, 20 years, but they can be very aggressive, and the morbidity is, the prognosis is quite poor. The symptoms of NETs can be extremely vague, including fatigue, diarrhoea, blushing, asthma, palpitations, breathlessness, and they can be confused with a lot of other common conditions, such as irritable bowel and quite frequently menopause. So how common are neuroendocrine cancers and what's the survival rate? We did a comparison between several other cancers, looking at pancreatic, multiple myeloma, brain, ovarian, cervical and testicular, and as you can see, that the actual incidence of neuroendocrine cancers is a lot larger than all those other cancers, which is estimated at about 17 per 100,000 Australians. So in the last lot of the Australian Institute of Health and Welfare statistics, there was 5,178 new cases diagnosed in that year. The 5-year survival rate of all NETs is around 48%, and that's compared to the survival rate of breast cancer, which is around 95%. Correct diagnosis can take an average of 5 to 7 years, and that's predominantly due to the lack of awareness. Once a person is finally diagnosed, in over 60% of the cases, the cancer has spread to secondary organs, making a cure through surgery less likely. And it affects both men and women equally from 15 years of age. So just to give you an introduction about Neuroendocrine Cancer Australia, our vision is to be champions of early diagnosis and a cure. Our mission is to assist and support patients and carers through support groups and access to networks of expertise. We also lobby for access to new and appropriate investigations and treatments. We like to raise awareness and knowledge of neuroendocrine cancers with the medical community and the general public. and we encourage and support Australian-based research in the area of neuroendocrine cancers. And we currently have the Planet Registry, which is operational, and we're about to launch on the AusNet nurse-led shared care model. So we have our 5 pillars, which is support, research, education, awareness, and advocacy. With our patient support, the highlights are that we have the Net Nurse Support Helpline, and on average, we're receiving over 180 contacts a month. This number's been increasing by about 25% each year. We've just done 2 new explainer videos, which are resources for patients to explain what neuroendocrine cancers are and what the neuroendocrine system does. We have support groups across Australia, which we do national Zoom meetings monthly and face-to-face groups, which are local groups, when we can. COVID has implemented greatly with this. However, we continue to provide the support for these patients whichever way we can. We also have a private Facebook group, which has over 1,700 active members. And NECA also remains the main referral source for patients around the country, with referrals coming from the Cancer Council or major hospitals and GPs and community. With education, within the first year of launching the GP education modules, which was in 2020 on World Net Cancer Day, we've had a doubling of the industry average of HCPs starting the course over an 18-month period. So to date, we've got over 1,800 GPs who have enrolled nationally and more than 500 nurses. And while we endeavour to secure government funding for much needed promotional campaigns for these healthcare professionals, we're asking our NET community, including patients and carers, to download the educational promotional flyer and take it to their local healthcare professionals, which to date has been extremely effective. Our website has been upgraded so that healthcare professionals can book in services online. And our Net Nurse, which was me previously, is performing in services around Australia from Esperance to Ipswich, and we've done over 230 nurses with training. So it's booked via a Zoom or Teams meeting, and it goes into their in-service time so that we can provide them with information about neuroendocrine cancer as an overview and also about the treatment options. And recently we've partnered with the Cancer Council Victoria, and we've produced a NET patient education program called Living with NETs, which is being launched this month. And I'm actually presenting that as a podium presentation at COSA this year. As far as advocacy goes, we've developed a national action plan, which is giving our community the focus and tools to advocate for themselves and for each other. And we've been lobbying MPs all over Australia. And we've also dedicated a web page so that our community can be armed with information with the latest facts and scripts so they feel comfortable to meet with MPs as well. We've done the development of the optimal care pathway, and our project officer, which was me, was seconded to the Cancer Council Victoria to collaborate and guide the writing of the optimal care pathway. This is to raise awareness with healthcare professionals and the general public, and it's hoped to be launched by the end of this year, and it's going to assist in improving referral pathways for NET patients. We also have done a Theranostics Roundtable, which had over 35 speakers nationally, which included government and private enterprise, and 255 attendees. We've produced a report about that, and it's looking at the current state of play and the future opportunities for theranostics in Australia. So the impact of working with the shared care model with Peter McCallum and Gippsland is that the objectives were to provide clinicians with a guide to deliver shared care in partnership, which is extremely important. The NETS patients will receive high quality multidisciplinary coordinated care, which is equal to that of metropolitan patients. And I know, having worked in regional and rural areas, that this is something that patients have been disadvantaged as far as access and equity because of distance and lack of resources. Also, one of the other objectives is to optimise use of hospital resources by providing care in the community so that patients aren't having to travel to the metropolitan areas and get high quality coordinated care in their own community. Neuroendocrine Cancer Australia was really fortunate to be included in the development, and we're extremely grateful for that. Neuroendocrine Cancer Australia can provide ongoing support through our telehealth nurse, through support groups and the Facebook groups. We also can provide patient resources to the patients that are involved in this shared care model, and clinical trials information, and also further survivorship opportunities. So NECA's involvement in the promotion, we've been included, we included the shared care model in a presentation that was done to Mark Butler, the Federal Health Minister, which was very well received. We've also put into our National Action Plan the shared care model, and it's an integral part of the National Action Plan that we have. We've also distributed the report for the shared care model to other centres of excellence, such as Royal North Shore Hospital. And I know that we've been included in the poster presentation for COSA this year. So just to summarise everything that's going on as far as neuroendocrine patients, and also for Neuroendocrine Cancer Australia, looking at getting more funding, that the average Australian waits over 5 years for a correct diagnosis. There's over 22,000 Australians living with neuroendocrine cancer. 60% of the patients are at stage 4 by the time of diagnosis. There's 1 Australian diagnosed every 2 hours with neuroendocrine tumours. There's over 5,100 Australians diagnosed annually. 1 in 2 patients report being originally diagnosed with something else, and 1/3 of patients report cost as a consideration when choosing cancer treatment. So if you'd like to get in touch, here's our contact details. And again, thank you so much for inviting us to be part of the annual forum, and we feel very privileged to be part of it. Thank you.
GRICS work closely with the Cancer Council Victoria to implement the Access project across Gippsland. The reason that we undertook this project was as a direct result of some auditing that we undertook looking at the supportive care needs of patients across Gippsland. Overwhelmingly, it appeared that people required more emotional support than we had services able to provide to them within Gippsland. So Cancer Council Victoria had already developed the Access project and had rolled it out across other regions within Victoria. So they'd run it across Barwon Southwest and the Grampians region. And it looks like a great project for GRICS to undertake to directly benefit cancer patients in Gippsland. So I'd now like to pass over to Catherine Lane, who's the Head of Cancer Information and Support Services at Cancer Council Victoria, to talk more about the Access project and the positive outcomes that we had here in Gippsland.
Hi everyone, my name's Catherine Lane. I'm the Head of Cancer Information and Support Services here at Cancer Council Victoria, and I'm also the project lead for our Access project, which stands for Accessing Cancer Care Services Equitably Using Support Services. The Access project came about towards the end of 2020. It's a Department of Health funded project that we pitched to really help us increase the support that we were providing to healthcare services throughout the pandemic. And really it was designed to help us more strategically promote the use of our services to health services, particularly across regional Victoria, but to also work with health services to implement a direct health professional-led referral pathway to us to really increase that, health professional-led uptake of our services to people with cancer, and to really increase people's awareness and understanding of what it is that Cancer Council Victoria can provide as a support and complement to what's already provided in regional areas. Cancer Council Victoria offers a range of supportive care programs. So I guess our main support service is our nurse-led information and support line, which is our Cancer Council 13 11 20 service. And really the role of those oncology nurses who are experienced nurses working in clinical settings as well. Their real role is to understand the needs of a person contacting us, and it can be anyone impacted by cancer, whether that's the person themselves, a carer, a health professional, anyone that has contact with someone affected by cancer. Really their role is to then understand what those needs are, what services they already have in place, and then what services and supports we might be able to provide access to really improve their experience. So we have a range of in-house supportive care programs that we offer. And we have things like access to counselling services, financial and legal assistance, our WIG service, our holiday break program, and our range of peer support programs that are available. But in addition to what we offer here at Cancer Council Victoria, our nurses have a role in linking people with support services offered by other community organisations, other not-for-profit organisations, but they also have a really important role in linking people back to services in their local community and in their health services if they're already not linked in. We know that psycho-oncology was an existing gap for many health services even before the pandemic, but obviously we know that demand has markedly increased since COVID has been around. So Cancer Council Victoria is able to offer access to psycho-oncology services if people have no access in their local community, or where demand may be meaning that there's a long wait time, or indeed where cost might be prohibitive for those services. So Cancer Council Victoria is able to offer two types of psycho-oncology support. The first is through our nurse-led counselling service. So this is for people who have, I guess, more lower level or more transient distress. So it might be things like adjusting to their diagnosis, dealing with fatigue issues or sleep disturbances, or really just adjusting to, I guess, life with cancer. So that nurse-led counselling service can provide access to people for up to 3 sessions with our nurse counsellor. And for people who have, I guess, that more acute distress or who need more targeted and more, I guess, acute support, we have the ability to refer through to our phone-based psycho-oncology service, which is offered in partnership with Cancer Council Queensland. So those appointments are offered via phone, and people can have access to up to 5 sessions with a psychologist who specialises in cancer care. And that doesn't mean that people can't then access other community support. So it's separate to mental health care plans or any rebates offered through Medicare. And really the aim of these services, as I mentioned, is to provide access to people for these services where they might not exist in that local community. With the Access project, we recognised pretty early on that the success of this project was going to hinge on our ability to be able to partner with local health services. And one of the ways in which we did this was to work really closely with the integrated cancer services in each region. So in Gippsland, we were able to work really closely with Stu Harper and Hayley Hall, who really worked with us to help us identify which health services in Gippsland were in a position to be able to participate, and to also really help us understand what their current supportive care screening practices were and where their biggest gaps were. And this really meant that we were able to provide a more targeted education strategy for those health services and to really understand what the state of play was so that we could really work to use the Access project to fill some of those identified gaps. So in working with the integrated cancer services and looking at the Gippsland region, what we found was that it was really the chemotherapy day units and radiation therapy units that were in a position to implement the Access project. And through a supportive care screening audit that Gippsland had completed, we really found that the gaps were in psycho-oncology and in access to financial and legal support. So we were able to work with the Gippsland services that were participating in the project to really educate them and empower them to understand about the services that we could provide through Access, and in understanding how to use the health professional online referral form to initiate those referrals to us here at Cancer Council so that we could assist in putting those services in place. So when we originally, I guess, pitched the Access project to Department of Health, we really thought that we would be in a position where we would be in a COVID recovery phase. And we really hoped that meant that we would be able to be out and about in the regions, presenting face-to-face in health services to really help the implementation of the project. However, as we know, COVID impacts continue to affect the way that we provide education and the way that we can provide support. So we really had to work closely with Gippsland to look at how we could deliver our education virtually and how we could really increase the uptake in those education sessions. So we were able to offer, I think, up to 3 education sessions for Gippsland Health Services, and we were able to record those sessions for any staff that were unable to attend at the time. And we've really worked to provide follow-up and to provide reporting through to the Gippsland Integrated Cancer Service so that they can understand currently how the health services in their region are going with referrals through to Cancer Council as part of the Access project, but to also help us understand how we can continue to support those health services in implementing the project ongoing. And really one of the areas that we'd love to be able to focus on with Gippsland and to try and tackle is access to supportive care screening and referral for patients who undergo surgery only, as we know that this is really a cohort that can struggle to access referral to those services. So we're really looking forward to partnering closely with GRICS to see if we can improve that access as well. So really pleasingly, despite all the challenges that we've faced with COVID, and obviously we know how stretched health professionals are and continue to be, we're really excited to see that we're gaining traction in the Gippsland region and through the health services that are participating in the project. All services that we've onboarded as part of the project have begun to make referrals via our online health professional form. And in the last few months particularly, we're really starting to see those referrals increase. So if we go from a baseline of no health professional-led referrals, we're seeing a real increase, up to 150% increase in referrals that are starting to occur. And we're really looking to, as I said, continue that education and support of health services in the Gippsland region so that they can continue to embed that referral into practice. And we know that Gippsland have a pilot planned with a couple of their health services to use a specific supportive care screening tool that actually signposts a referral to Cancer Council Victoria as part of that process. So we're really, really grateful for the support that Gippsland have been able to provide. And I think it's a really great example of how we've been able to partner specifically to address those needs that have been identified in the region and to really look at ways that improve that supportive care screening process in a way that hopefully doesn't overburden already stretched health professionals, but really keeps the person affected by cancer at the centre of that process. I'd really like to thank the Gippsland Integrated Cancer Service for their support of our Access project and for being so willing to work with us during really challenging times. We're also really, really grateful to the health services in the Gippsland region that have really worked to support the project. We know how stretched health professionals are and continue to be, but it really is a credit to Gippsland Integrated Cancer Services and their relationship with their hospitals to see how well the project is going, and we're really looking forward to only seeing that success increase over the coming 18 months.
I'd like to introduce you to Sinead Hickmott, who's the new Nurse Unit Manager of the Chemotherapy Day Unit at West Gippsland Healthcare Group in Warragul. Sinead was the Project Officer for one of the service improvement grants provided by GRICS. Sinead and her team were looking into better supportive care opportunities for men with prostate cancer. Sinead will share with you the outcomes of that project and the successes that they had at West Gippsland.
Hello, I'm Sinead Hickmott. I'm a nurse and I work in the oncology unit of West Gippsland Healthcare Group in Warragul. And I've been fortunate enough to be involved, be the project lead of a GRICS project looking at supportive care screening for men diagnosed with prostate cancer in the local shire of Bawbul.
My name's Linton. I'm an 11-year survivor. I have 3 brothers also who are survivors and 2 nephews who are having treatment. There's 5 more nephews to go and our own 2 sons.
Pam, I'm Linton's support person. Been involved with prostate cancer for over 11 years.
We ran a support group in Bairnsdale for a number of years. Through circumstances, we've shifted to Moe, found out there was a need for a support group in the Bawbul Shire, because there's nothing between Bairnsdale and Dandenong. So we started to make inquiries. Sinead, with all her contacts, has been instrumental in getting the group up and running. We got started last March and it has slowly grown. More men and their wives coming on board, because wives are the main support that we have. And Sinead's work has been invaluable to get the group up and running.
So prostate cancer in Australia is quite a significant cancer. Recent stats have shown that it's the most commonly diagnosed cancer in men. Approximately 24,000 men will die of prostate cancer this year in Australia, and around 3,500 will be diagnosed. So when I received Sinead's email to say that she was setting up a support group as part of her a grant that she received from GRICS, it was music to my ears, because we know the value of support groups. They can reduce the fear of isolation and depression. They are a safe space to men to congregate and talk about the most intimate of details. And that's something very special, and a lot of men in regional and remote Australia miss out on. Sinead and I were fortunate enough to meet up with Linton Blackwell, who is running the Ball Prostate Cancer Support Group. Sinead has been a great influence in this, being able to funnel men into the support group or letting men know that it is available. You'll find that some men don't want to go to a support group in the beginning. They may feel that it's all a little bit overwhelming, and they might join a support group down the track. And we often hear the comment that we wish we had have come sooner.
It's been really a series of just opportunities that have presented that have been so fortunate in their timing. And the prostate cancer support group for Ball was one of those. Linton and his wife Pam literally put up their hand to say that they were willing to get a support group up and going. And it was at the time almost, within weeks of me starting the project. So it was really an opportunity that was just far too good to let go. And Pam and Linton they're integral. I can't run a support group, and I've never had prostate cancer. And Linton and Pam are just the epitome of what a support group is. They are so willing to help anyone. And it's a great relationship that we've developed, and I'm incredibly grateful for what they're doing for our community.
Well, we've got lots of information if people have just been recently diagnosed, information through the Prostate Cancer Foundation and through Cancer Vic. When they come in, yes, people are a bit, what do we do, how do we relate? So we just try and talk to them, other members. We have a round table thing where everyone can speak up with what problems they've got, if they're having trouble with treatment. We're not doctors, so we can't advise on treatment, but we can suggest where to go to get more help and just try and keep people relaxed. Being an 11-year survivor myself, it can show them that, hey, it's not all bad. There's plenty of life after prostate cancer.
When we were in Bairnsdale, we would go out and talk to the people in their own homes, and a lot of the time the women wanted to talk separate to the men, so we would have a nice conversation away from the men. And it's amazing, some of them just needed a shoulder to lie on or hug or whatever. We're always there.
Alan Cunningham is a fellow that we met through Linton. He was there in the first meeting of the prostate cancer support group, and he made me really aware of just one little thing that we can do to help men with prostate cancer, and that's Bins for Blokes. Bins for Blokes is an initiative by the Continence Foundation of Australia. And it's about getting bins into men's toilets to facilitate them being able to dispose of continence aids appropriately with dignity and respect and all of those things. So just in the last couple of weeks, I've been canvassing Ball Shire, a local hospital, and also Lardner Park, which is a local facility that puts on lots of events. So for the month of October, they actually have 19 events just for 1 month, and they have enormous events that attract thousands of people. So Lardner Park have installed their Bins for Blokes this week, and West Gippsland Health Group Executive have just given endorsement for the project to be rolled out across our facility, and Bauble Shire I'm still in the works on, but I'm not going to let up, so hopefully that will proceed. And the Continence Foundation of Australia and Alan are incredibly grateful, and they'll be advertising our Shire's success in the hope that we can share that in multiple Shires. And it was incredibly easy. The only thing that I needed was time, and I'm grateful that my role in the project has been able to facilitate that. But Linton talked about the experience of men suffering depression, and some of that is because of their social isolation. And if having bins for blokes in a facility like the Lardner Park means that a man might go to Farm World, or he might go to his granddaughter's deb ball, or he might just go out there for a car show or to the calf market sale, at least he'll be able to do it with dignity.
Sinead and I also went to the Farm World event earlier this year, where we had to wrestle men to actually pick up a brochure for prostate cancer.
She came and spent 4 days at Farm World so that we were able to stand up along with GRICS and the hospital and the Continence Service of Warragul. We had this great little stall that just was there to broadcast issues around men's health, not just prostate cancer. I was overwhelmed. I didn't know a lot about prostate cancer, and when I started the project I was looking at all of the resources available, and it's incredibly overwhelming even as a health professional. So wading through all of those resources, looking at what was reliable, what wasn't reliable, what was useful and what was accessible was one of those issues. So I started making a spreadsheet, and then the spreadsheet actually became really useful within our own chemo day unit, becoming a resource for, I know where there's an exercise physiologist, or I know where there's someone who is able to help out with continence, or all of those sorts of things. It became a real resource, and I thought I need to put it into a useful format. So that's why I'm developing this quick guide, and it is specific to our Shire. It has certainly got specific things for prostate cancer, but it actually, a lot of these resources are across the board. And because prostate cancer is now the most diagnosed cancer, there's barely anyone who's not been touched by it.
Sinead, I can't speak highly enough of you and the work that you have done to make all of this happen. And I'm particularly grateful for GRICS for the grant that they provided to fund this as well. We do know that areas that have a support group and have the backing of their cancer integrated services do much better, and the men have better outcomes. So thank you from all of us at PCFA.
I feel like I'm actually making a difference, and I just hope that other people are able to see how easy it has been. And if you're willing to ask a question or make yourself vulnerable, the answer yes or no is all that you've got the option of getting. And if you're happy to accept a no, there's quite the possibility that you might get a yes. You'll get an ear that's willing to listen to you and be grateful to back you and just support you. And it makes a huge difference in the outcomes. And yeah, I'm grateful. I've got until May, and I'm really excited. Everyone knows that, men are reluctant to seek help. So it's so important if we can just facilitate it in just the smallest ways. And I've taken a different view on this project. It's my first time of ever doing a project, and I've always been a hands-on nurse. So taking a project from a different perspective, I think, has meant that I've had probably different outcomes. And I don't know from a GRICS perspective if it's what they had wanted, but I was really, really focused on having outcomes. I just didn't want to, have this opportunity and waste it.